Good evening to everyone. Welcome to the Tuesday night with the doctor. For those who are watching live on Facebook, thank you for watching. And for those who are watching via Zoom, we welcome you all. I am your moderator for this evening, Mel Sangha. This evening, we are so grateful that we have a guest, a resource person, that will discuss the topic about allergies and asthma. We know that especially during this season, allergies are common concern of everyone because of the changing weather from cold to warm. Weather is our number one concern. So having that concern, I'm totally convinced that our resource person this evening can explain to everyone about allergies and asthma. It is my pleasure to introduce to you our resource person for this evening topic. Our guest speaker is this evening is the program director and the chief of Albany Medical College Division of Allergy and Immunology. He is a professor of medicine, pediatrics, immunology, and microbial disease. Our guest speaker this evening is no other than Dr. Jocelyn Celestin. But before I give the time to our guest speaker, I would like to remind everyone watching on Facebook and those who are live on Zoom that right after the presentation of Dr. Celestin, you can type your question on the chat box of your computer or whatever gadget you are using, and our guest speaker will answer those questions. Dr. Jocelyn Celestin, it's your time.
Thank you, Mel. It's really a pleasure to be here. We had a little confusion about the time, but I'm glad we're here and we're going to get this done. I will need to be able to share my screen with you guys. Let's see, let me try that. Share screen. And I'm going to go right here. Good. Can everybody see my screen?
Yes, doctor.
Good, good. So tonight I'm going to talk briefly about allergies. Obviously, this is a very complicated topic, but we're going to try to highlight the important points. So by the time we're done here, we can have an idea what allergies are and what we can do about them. Okay. So those are my goals. Understand what allergies are, know the common manifestation of allergies, know how allergies are treated, and know how allergies can be prevented. Okay. So when people have allergies, we say that they have hay fever. And the concept of hay fever is a historical concept where it was observed that people, when they're handling hay, they can have trouble sneezing, runny nose, itchy eyes. Another term which is used is the term rose fever. But not everybody who has runny nose, itchy eyes, not everybody who has those symptoms, congestion, not everybody has allergies necessarily. There are other types of conditions that can make people behave as if they were having allergies. One would be infections, for instance. It's very difficult at times to differentiate somebody who has a cold versus somebody who has an allergy. And sometimes only time will tell, or the pattern will tell us, but sometimes it's difficult to differentiate. People can have rhinitis that is secondary. For instance, pregnant women can have nasal congestion, runny nose. People who have problem with their thyroid, certain medications that people take for blood pressure, for instance, can cause them to have nasal congestion. Irritants, of course, strong odors and fumes. Sometimes people sit down to eat a good meal and they start having runny nose and sneezing. So that can happen. We call that gustatory rhinitis. Some people have rhinitis only when they lay down, and usually it could be on one side, it can be on the other side, and we call that vasomotor rhinitis. But people with allergies, the pattern of allergy can be either seasonal or perennial. As Mel was alluding to, there are people who become somewhat miserable during this time of the year. And this is because the pollens in the air stimulate the immune system, and they start sneezing, they have runny nose and congestion, and some even may have asthma symptoms when they're exposed to pollens. So that would be seasonal. Some people have symptoms only during the spring and the fall. But there are other people, those who are allergic to pet dander, to dust mites. Those patients may have symptoms all year long. They may have a little bump in the symptom during spring and fall, but all year long, they may have congestion, runny nose, itchy eye, etc. So what are allergies? Someone is said to have allergies when his or her body reacts excessively to one or more substances to which most people don't normally react. So that is a very good definition of allergies. When somebody says, I have allergies, it means that that person's body reacts to things that most people without allergy will not react to. So that's what it means to have allergies. So what are the players? What are the factors that will cause somebody to develop allergies? What are the factors? This little graph here gives us a very good idea how people develop allergies. This is clearly an oversimplification of what is really happening in the body, but that's an idea more or less that we can conceptualize and try to explain what's happening when people have allergies. So the first thing that happens, number one here, is that an allergen enters cells of the body. That allergen here represented as a square, little square, could be anything. It could be a food, so in the case of peanut, in the case of milk, or it could be something like dust mite, it could be cat dander, dog dander, it could be a mole, it could be a pollen such as birch pollen, it could be grass pollen, but that allergen enters the body and it's represented here by that little square. Okay, so that little square gets in contact with a cell of the body. That cell could be in the nose, in the gastrointestinal tract, or in the eyes, or in the lungs. So that cell picks up that allergen. Okay. Then that cell metabolizes, in other words, transform this allergen in a certain way and presents it to another cell of the body that we call a T cell. That T cell will recognize that particular allergen, and that T cell will start multiplying, okay? And then that T cell will stimulate another type of cell called B cell, and that B cell will make an antibody, okay? That antibody that B cell is going to make is going to be specific, precise, and unique to that allergen, okay? So once that B cell is mature, it's going to be transformed into another type of cell. That same B cell is going to be converted into what we call a plasma cell. And that plasma cell is what is going to become like a machine making antibodies. So those little Y that you see there are antibodies that are very specific for that particular allergen. So somebody can be allergic only, let's say, to peanut. That antibody will be very specific to peanut. Somebody can be allergic to dust mite. That antibody, that type of antibody will be very specific for dust mite. So the plasma cell, which comes from a B cell, makes those antibodies. Those antibodies will be floating into the blood all over the place, and then they will find their home onto another cell that we call a mast cell, okay? A mast cell. The mast cells is a cell that is there waiting for the antibody. And so the antibody attaches itself to the mast cell, okay? And once the antibody attaches itself to the mast cell, we call that mast cell, we say that mast cell is sensitized. Okay, when we say that somebody is sensitized, it means that that person has antibody that are attached to the mast cell. So once that sensitized mast cell sees again that same antibody that provoke the formation, sees again the allergen, that provoke the formation of that antibody, so that mast cell is going to be activated and is going to open up and is going to release a number of chemicals. And those chemicals that are toxic are the chemicals that are going to cause the allergic inflammation, okay? One of those chemicals, one of the most important chemicals that the mast cell is going to release is called histamine. And histamine is the troublemaker. Histamine is the chemical that is going to cause the itching, the swelling, the discomfort that people with allergies feel. Okay, so briefly, we have an allergen. Allergen is picked up by a cell of the body. That cell makes contact with a T cell. Okay, that T cell is going to stimulate the B cells to make a specific antibody. That antibody is going to attach itself to the surface of mast cells. And then once the sensitized mast cell sees the allergen again, it's going to degranulate, open up, and release the chemicals that cause the allergic reaction. This is a very simplistic way of looking at it. It's much more complicated than that, but I think you get the idea. Okay. So those are the allergens that we are talking about. It can be pollens, grass, weeds, trees, dust mites, mold spores, animal dander, urine and waste of certain animals such as rats, food items, peanuts, fish, shellfish, tree nuts. In adults, peanuts, fish, shellfish, tree nuts are more common. And in children, it's mainly milk, eggs, soy, and wheat. They become sensitized to. Stinging insects, venom, like honeybee, yellow jacket, yellow hornet, white-faced hornet, wasp. All of those insects can produce venoms that can trigger an allergic reaction. Certain medications also can become allergens, such as penicillin, which is the most common one, cephalosporin, such as Keflex, sulfa, such as Bactrim. Those drugs can become allergens. And some people can develop allergies as well to certain plants, such as poison ivy, poison oak, sumac. Some people can be allergic to latex or to certain metals, such as nickel. So there is a wide variety of substances that can become allergens in the susceptible individual. So how do we recognize allergic signs and symptoms? When people are sensitized to inhalant, things that you can inhale, allergens, things in the air, and the nose, they can be runny, they can have congestion, they can have sneezing, itching, because those are the things that histamine would cause. And the sinuses, they can feel significant congestion, they can have headaches, the eyes can become itchy, teary, red, the ears can be itchy, or people may feel that they have their head underwater. The throat can become very itchy. People may feel that they have mucus dripping in the back of their throat. Sometimes the palate can be very itchy and uncomfortable. And then some people in the lungs, the windpipes can become very tight, and they may experience heavy breathing, shortness of breath, and some of them may wheeze. They may have congestion or feeling that they have mucus in the lungs. All those things can happen in people with allergies, and they are mainly mediated by histamine. But there are other mediators as well, other chemicals. Some of them we call leukotrienes, that may play also an important role in causing those symptoms. So when people are sensitized for food allergens, the mouth can become itchy, the tongue may swell, the throat may swell dangerously. The skin can become itchy, they may flush, they may develop hives, swelling of the lips, swelling of the eyelids, they may develop eczema. And if the intestines are affected, they may have vomiting, abdominal pain, explosive diarrhea. And if it is the genitourinary tract, they may have incontinence. A number of things can happen in those cases. So the venoms and the drugs, usually they will cause rashes, swelling, hives, and we mentioned already respiratory. This is a schema of the places where people can have allergies. As you can see here, for instance, the eyelids can be a place of allergies, particularly in women that develop allergic reaction to things that to products that they use on their face. They can develop allergies to those things. Perfumes, certain perfumes, they can become allergic to them. Earrings, necklaces that contain nickel, even sometimes to gold, they become allergic to gold and can have reactions. Deodorant that people use can also cause them inflammation and allergic reaction. Watch band, if it is leather, they can develop allergy to the leather. Buckles, you know, and soap, hand lotions, rings, all those things, they can develop allergies to all those things. Fingernails, the products that they use for the nails, polish and removers, and sometimes they can become allergic to the elastic bands and the intimate clothing and the undergarments, and sometimes is the type of shoes that they use. They can develop allergies to that. If they're working in the garden, they can develop sensitivity to poison ivy, usually in the legs, and they scratch it and they carry the oil into other parts of the body, and they develop IV poisoning. So all those areas can be affected by a number of allergens. So when patients come to the allergists, usually the pattern, the places, the timing, and all those things can help us determine precisely what type of allergen caused the reaction and how to manage it. So one of the important reactions that can be life-threatening is what we call anaphylaxis. Anaphylaxis. You have heard anaphylactic shock. The anaphylactic shock is a terrible, very serious type of reaction that can happen. Usually it happens when multiple mast cells in the body recognize an allergen, and then they massively release histamine, and the histamine overwhelms the body, and then patients can have that life-threatening type of reaction called anaphylaxis. Okay, an anaphylactic reaction, when it's occurring, the patient may tell you, I feel that the world is ending. Okay, that's a feeling of doom and gloom, okay, that they feel. They feel something sinister, something terrible is going to happen to them. If you have a patient in your office that tells you that, you have to get ready to use the epinephrine to try to reverse that anaphylactic reaction which is coming. Usually patients who are undergoing anaphylaxis, they would have generalized itching, they would have body hives, they would have swelling of the lips, eyelids, tongue, swelling of the windpipes. They may have multiple of those symptoms, of those signs, or they have only 2 of them, only 3 of them. But any combination of those signs, if the patient has been exposed to a medication or exposed to an allergen, then we have to think about anaphylaxis. Wheezing, dizziness. The dizziness usually is due to the fact that the blood pressure can drop. The blood pressure can drop like a rock. And when the blood pressure drops, there is not enough blood going into the brain. That can cause dizziness. Also, the patient may collapse. You know, we call that shock. And the heart is not getting enough blood to pump. So the person may lose consciousness because of that. And the patient may become incontinent, may defecate or may urinate. And the blood pressure may drop. The heart may get into arrhythmia. All of this because of the excessive amount of histamine in the system. And the patient ultimately can have cardiorespiratory arrest that requires CPR. So this is a very acute, a very severe form of an allergic reaction that we call anaphylaxis. The majority of patients with allergies will have the runny nose, the itchy eye, the scratchy throat, the hives and the itching. But some patients may develop anaphylaxis, and this is life-threatening. This is an emergency. So how do we evaluate somebody who may have allergies? The first thing we do is to take a history. This sending things over the internet, you know, to be tested for allergies is not the best practice. You have to sit down or in video conference with somebody, and then they should ask you very specific questions. What type of symptoms do you have? When do you have them? What improves the symptoms? What make them worse? Okay, all those questions. What time of the year? What time of the day do you have those symptoms? All those questions may help the physician determine whether or not an allergy is in order. Also, the physician will examine the patient. We'll look into the nose, we'll look at the eyes, we'll check the skin, okay? We'll listen to the lungs to hear for wheezing or mucus. And then they will do what we call a skin test. A skin test is when the allergist takes a battery of allergens, all the allergens that we mentioned, and then they do what we call prick skin testing. The prick skin testing is that they have some kind of device where they put the allergen on the skin so the immune system can be exposed directly to the allergen. If there are sensitized mast cells under the skin that are exposed to a specific allergen, those mast cells will degranulate, will release the histamine, and then locally the patient is going to have a swelling and itching, meaning that histamine has been released. So that's how we detect the allergy, by doing a skin test with a specific allergen, trying to determine whether or not those mast cells have those antibodies that I showed you on the surface. If they have those specific antibodies, they will degranulate and you will see a local reaction, which will be swelling and itching. That's a positive test. If the mast cells do not contain those antibodies or the specific antibodies that we put that correspond to the allergen that we put to the skin, there will be no reaction, and that's what we call a negative test. We also sometimes do what we call patch tests. The patch test is mainly to detect patients who may have a contact allergy, like if it is latex or metal or gold, or so we do patch tests where we put the chemical on the skin and the back, leave it there for 3 days, and then afterwards people come back, we remove it, and we see what they react to. That's a form of allergy that we call contact dermatitis. So we do what we call patch tests. Patch tests and skin tests are different. Okay, the skin test detects immediate allergy, and the patch test detects a delayed allergy. Sometimes we cannot do a skin test. We do what we call a RAST test, R-A-S-T, which is a blood test. If we cannot demonstrate that those antibodies are attached to the mast cells of the patient, sometimes we can demonstrate that those antibodies are in the blood. And the way we do that is by doing a test that will help us detect those specific antibodies. So this is called a RAS test. There are conditions in which we cannot do a skin test. If the patient is taking medications that could interfere with the skin test, then we do a blood test. If we feel that the patient is having asthma related with allergies, sometimes we do also what we call a pulmonary function test. The pulmonary function test will tell us whether or not the windpipe of the person, of the patient, the windpipe is constricted, preventing air from getting through, causing asthma symptoms. So we take a history, we examine the patient, we may do skin tests or blood tests, and we may do also breathing tests. So once we determine that somebody has allergies, what can we do about it? Well, there are allergens that are very obvious that can be eliminated. For instance, if somebody is allergic to dust mites, if they put dust mite covers on the pillows and the mattress, that may be sufficient to minimize the exposure to dust mite allergens. Okay. If somebody is allergic to his or her cat or dog, and they can get rid of the animal, which is not very usual, but that can take care of the problem. So avoidance of allergens, sometimes, or very often, we try to control the symptoms with medications. Because histamine is a major player, we give people antihistamine. What antihistamines such as Claritin, Zyrtec, Allegra, Zysol, Benadryl, what those medications do, they essentially block the receptors for histamine on our cells. So the histamine is released, but it cannot bind to the receptor to cause the itching or to cause the swelling or to cause the problem. So antihistamine can be very helpful. Decongestant are things like Sudafed that can help shrink the blood vessels that are dilated in the nose and reduce the congestion. Nasal sprays, things like Flonase, might be helpful. Patient with asthma may benefit from inhaled steroids, things like Advair, things like Symbicort, things like Asthmanex, etc. There are certain other medications that we call mediator antagonists that can be helpful, such as Singulair or Montelukast, that can be helpful. So we have a variety of medications, multiple medications and those different classes that we can use and we can adjust to the need of the patient. Now, some patients, even if you avoid the allergens or you provide them symptom control with medication, they're still miserable. And some of those patients may benefit from a modality of treatment that we call immunotherapy. Immunotherapy is when we take the things that the person is allergic to, we put it in a serum, and we inject the person with that serum over a period of time, and their bodies develop an immunity, a tolerance to those allergens. This is called allergy shots, allergy injections, or immunotherapy. It's very effective, and that's the most effective way to get rid of allergies. How can somebody prevent allergies? Smoking is bad. Smoking can make people more susceptible to allergies. Mothers who breastfeed their children can protect them from developing allergies. For instance, if they start their kids on peanut early on, there is a possibility that those kids may not develop peanut allergy. And the diet during pregnancy and the diet during breastfeeding may play a role there. And the role of house pets is also very important. Okay, so I think I went over my time, but the idea was to give you some notion of what allergies are. And then if you have questions, we can entertain them at this time.
Thank you so much, Dr. Celestin. I know that your presentation is very clear, and a lot of people watching on Facebook and by Zoom clearly understand about allergies and asthma. So for those of you who want to have a question that the doctor will answer, it's ready now. So please chat on your computer.
Okay, so it looks like this question is from Annette. Why is there a difference in food allergies from children to adults? We're not quite sure. It has to do with the susceptibility that children have to develop allergies to certain materials. And that may have to do with the immaturity of the gastrointestinal tract, where the allergen gets through the body through the gastrointestinal tract. It may have to do with that, but we're not quite sure. But the pattern of allergies, of food allergies in children is very different from that of adults. And some of those children with food allergies can outgrow them. And adults sometimes can, out of the blue, develop some strange allergies. And we do not always understand why the immune system does that.
All right.
So another question is from Alan, will exposing yourself to the allergen on a regular basis can help develop someone's immune system stronger? Yes, and that's the notion of immunotherapy. What we are doing when we do immunotherapy is to inject the very thing that the person is allergic to, exposing the immune system little by little to that allergen, and then over time, they develop a tolerance to it. Think about it as trying to tame a wild animal. That's what you're doing. So the reason why I use that analogy is because sometimes that wild animal can get at you while you're trying to tame it. And that's the reason when people get allergy injections in our office, we make them stay for a period of time and observe them, because in theory, they can have a severe reaction to that allergen that can be anaphylactic. So yes, exposure to the allergen in the right way can make the immune system stronger, yes. What causes food allergies? This is from Annette again. Essentially exposure. If you don't get exposed to something, you're not going to be allergic to it. But exposure is not enough. You have to have certain features of your immune system that would make you uniquely susceptible to that allergen. Okay, so it's a combination of gene and environment. You have to be exposed to it, and the genes that you inherit from your parents or the genes that you get should be susceptible to make those antibodies that will make you allergic. The next question is from Emily. Do you have to be eating the foods causing reactions for you in order to show up on blood testing? Okay, if so, for how long should one eat the suspected food? Okay, so when you eat a food, you can develop antibodies to that food. Those antibodies are usually IgG, immunoglobulin G. They have absolutely no value in determining if somebody is allergic. However, if somebody develops immunoglobulin E, IgE, to that particular food item, then they become allergic, okay? So there are some people out there that will tell you, just send me your blood and I will tell you if you're allergic. Those people are measuring IgG that has absolutely nothing to do with allergies, and that can be confusing. If you suspect you have allergies, you have to go to somebody who has been trained, who is board certified, and that will do the proper test for you and tell you exactly what you're allergic to, okay? So if you eat something, you get exposed, you may develop IgG, but if you make IgE for that particular food, you can become allergic. What causes sinus allergies? Sinus allergies is exactly the same as nasal allergies or lungs allergies. If you're allergic and you get exposed to the thing that you're allergic to, then you'll develop sinus problem, congestion, headaches, like your head is floating, you cannot concentrate, you cannot think straight. Those can be signs of allergies in the sinuses. Based on the similarities of the symptoms, is there a way to tell if one has coronavirus versus common allergies? Yes, people with coronavirus may have trouble smelling, may have congestion, but they also have fever when they have coronavirus. They don't feel well. They are very weak. They have muscle aches, they have muscle pain. Usually those symptoms do not occur in allergies. Usually, almost never somebody who has plain allergy will develop fever. Okay, even though they call it hay fever, people with allergies almost never have fever, which is not the case for COVID-19. Next question, that's from Trent. Lisa, if someone develops a sensitivity to something as an adult that they didn't have when they were younger, can it progress and become worse and develop into an allergic reaction as they become older? Yes, that can happen, but the contrary can happen as well. Allergies can become worse over time, or they can become better over time. Currently, we don't have good markers to tell us who and which patient there will be improvement or worsening of the symptoms. But both things can happen. This question is from Leanne. For something like pollens, does it help to take some of the local honey in your area to help eliminate some of the issues? This is more folklore than science. A lot of people believe that if you use local honey, that can help you with your local allergies, but that has never been demonstrated scientifically. Let me clarify that there are a lot of things that have not been demonstrated scientifically that are true. Usually, we get scientific proof very late. The Chinese may have been using something for 3,000 years and they say it works. And we scientists say this is just quackery. And after a few years, we discovered that the Chinese were right. So that has not been demonstrated scientifically that local honey can help with allergies. But this is not something that I would say that people should not do because it cannot cause any harm, you know, eating local honey.
All right. So, Dr. Celestin, I have a question.
Yes, Mel.
Since I start working at the hospital, every time I use the hand sanitizer, I have a rashes on my hands.
Yes.
And is that a kind of allergy?
It could be allergy or it could be an irritant effect. You know, the sanitizer is very rough, very harsh on the skin and can cause an irritation. So there are a number of things that I would suggest that you do is make sure that you use a lot of moisturizer in your hand because the sanitizer can be very harsh. So we would have to see to determine whether or not this is an allergic reaction, but in all likelihood, it's going to be an irritant effect due to the harshness of the sanitizer. Some people have very sensitive skin and that can get irritated very quickly. Yes, now, if the skin is irritated, then it can make it more easy for you to develop an allergic sensitivity to some perfumes or to some chemicals or to latex.
Yeah, because every time I wash the dishes also, and I'm using the washing, you know, the soap.
Yeah.
It irritates.
Yeah, it irritates.
Yeah, and I thought I was free from using that, but my wife told me use the gloves.
Yes.
So that
Yoli is always right.
Yeah. Alan also has a question. Is okay. Is allergy to eggs considered a contraindication for some vaccines?
Okay. Initially, we thought that was the case. However, most patients who have allergies to eggs, even patients who have had anaphylaxis to egg, can be treated with vaccine that contain eggs without any problems. Okay. So the amount of egg which is in the vaccine is so minute, so small that most patients with egg allergy can easily receive vaccines that may contain certain egg protein. So we routinely immunize patients who have a history of egg allergy with vaccine that contain eggs.
Okay. Another question with from Emily. with chemicals, perfumes, is that considered an allergy if it causes shortness of breath, wheezing, dizziness, etc.?
Yes, it's not an allergy necessarily, but it's an irritant effect. There are people who have asthma or a little bit of asthma or baseline asthma. When those people get exposed to strong odors, fumes, Ajax, Clorox, they can develop a reaction, trouble breathing. But this is not specifically what we call an allergic reaction, but this is an irritant reaction.
Okay. Another question, will wearing a regular mask outdoors help me avoid an allergic reaction to dust or certain types of airborne allergens?
Regular exercise is good for everybody, but I don't think if you're allergic to pollens, for instance, or to dust, being outside is good, but I don't think that per se is going to take care of the allergies. You're going to have to take some medication to help with the symptoms, or you're going to have to undergo a desensitization with the allergy shots that we talked about.
Another question. So if someone has a topical sensitivity, not an allergic reaction to certain foods, can they eat them in small doses with the hope of building immunity to it?
This theoretical concept is a theoretical concept, but it is not something that we would necessarily recommend, because that has not been studied and we don't know if that would make things worse or better. I would not recommend that.
All right. Any questions? I hope that all the questions have been answered and it's very clear to everyone. I hope that all of your concerns have been answered by our resource person and became helpful and learned something this evening, Dr. Celestin.
Thank you.
Thank you so much for our guest, Dr. Celestin.
Yeah, it's always a pleasure.
And to all our viewers this evening, please come to our next event, Real Talks About Grippe, with Chaplain Roman Koslov, Sunday, May 23, 2021 at 6:30 p.m. So thank you so much, Dr. Celestin.
Thank you to everybody. If you have further questions, you can email me. Is celestj@mail.amc.edu.
Okay.
Or you can talk to Pastor Lanley, and Pastor Lanley can put you in touch with me.
All right.
Okay.
So thank you so much and have a wonderful evening, everyone.
Thank you, Mel. My love and regards to Yoli.
Yes.
Okay.
She's watching.
Okay. Bye-bye. Bye-bye.
Thank you, Dr. Celestin.
Okay. Thank you, Pastor Lanley. Okay. It's a pleasure. Bye-bye, Annette. Bye-bye,
Bye-bye.
Pam.
Take care. Thank you.
Bye-bye, Pam. Alan, I miss seeing you.
Bye. Thank you so much, Dr. Celestin.
Okay. Lisa, bye-bye. I saw the big boy the other day.
Yes. Thank you. Thank you so much.
Okay. Bye-bye. Bye-bye.
Bye-bye.